Hello, it's Alicia. I'm back. I have some updates for you guys. And one of them is that I'm working on my filming. So if my lighting sucks or whatever, I'm sorry. I'm not a professional, but I'm working on it. And I get very annoyed when I upload videos and then they're too dark to see my teeth. So I'm working on that. Hope you guys can see everything pretty good this time. It looks good on my end, but it's just a daylight bulb and it's not a good camera, but I do have one. I wanted to show you guys, well, at least let you know that I'm going to be working on my videos, and hopefully I'll be able to actually start filming them with a camera and then editing better or something, or figure out my lighting. But anyways, I'm Alicia. I'm back with an update for you guys. It's been about 3.5 weeks since the surgery day for me, which was May 13th. I had 13 teeth extracted, 6 mini implants on top, 4 on bottom, and snap-in removable over dentures or snap-in dentures, whatever you want to call them. So my last video, I was telling you guys that I had written an email to my surgeon because it was not very clear to me if these were supposed to be temporary or not. I just wasn't sure, and I wanted to make sure that I listed my concerns so that there would be no question that I had brought it to their attention in a timely manner, blah blah blah. So I got an email response and they said, yes, we're going to remake them for you. We'll deal with the other issues in person. So I had an appointment to go in a couple days ago, and I was kind of expecting to see Dr. Shatkins after the email. Like, I thought, you know, I'd see him and get to talk about the issues. So it wasn't Dr. Shatkins, it was one of his partners, Dr. Powers, and I saw him on my 5th day, and I think it was the first time they tried to do any adjustments, and it was the day that I hyperventilated, and I was in so much pain when they tried to take the teeth out that we just couldn't do it. So I left on day 5 feeling very just depressed because, I don't know, I had really wanted them to fix the issue of my jaw not shutting all the way. I had to wait a while, and then, so when I was there a couple days ago, I let him know that that's my main concern. I'd like my jaw to shut all the way naturally when I'm at rest. Like, my teeth would touch or whatever, so my mouth was shut, but my lips would never touch anymore, and they used to all the time before surgery, so it felt very unnatural. So he started working on that. He started drilling on these teeth while they were in my mouth first, and he was doing more on the bottom left or the bottom right, and then he had me take them out, did some more adjustments, and then put him back in, and he left because there's a bunch of like booths or whatever, and he was making his way from one to the other, like helping each patient, so he left. The nurse said, okay, so how do you feel, is that better? And I was like, to be honest with you, no, I still can't shut my jaw all the way, and I think it might have something to do with the fact that the top one is lower on one side, because that side is tight to be chewing. So she said, okay, I'll let the doctor know and he'll be back. So when he came back this time, he had me take the teeth out, and each time I would take them out, he would do some adjustments, put them back in, take it back out, put them back in. I think we took them in and out 10 times, like, for definitely. So that's the most I've ever been able to take my own teeth out in one sitting with no mirror, with sort of a little pressure because they were waiting for me to do it. But I was like really happy and proud of myself that I was able to just get them in and out. And a couple times they snag and they still pull, or they get a little uncomfortable, but it's nothing like the pain that it used to be. 1 second, please. Hold on. So I was really excited that I was able to get them in and out. That's like a light at the end of the tunnel, because for the first 2 weeks, it was excruciating trying to get these out. Like, I felt like the snaps were too tight. I still have a hard time getting the bottom one out because it seems like it just gets stuck tighter on one of the front implants. So when I pop it with one side, I put my nail like under here, right there on that side, pop it up, and then the other side, it still gets stuck in the front. Okay, this is like the 3rd time that I was interrupted already. So, okay, so for the teeth, when I get them out, I slide my nail underneath the gums, like right there in the back, and for the top. So I take my thumbs and I slide them up under, and then I nudge one up and then nudge another one up the other side, and then usually they should just pop out, but mine get stuck, so they don't always. And I just, for the first few weeks, I was just did it very patient at my own pace, you know, got a towel out, put it in the sink, lean over the sink, and just distract myself and try to wiggle them out. Now that it's been 3 weeks, it takes me less than 5 minutes to get the whole thing done. I I have a little routine with my teeth so far because my dentist told me just to brush them with toothpaste. So I like to brush my teeth in the morning, like with them in my mouth, which is pretty cool because I used to have to take my partial out to brush my teeth. And now I can just brush my teeth like normal. So after I brush my teeth, the roof of my mouth, my tongue, everything, the gums that I can reach with a toothbrush, then I unsnap the teeth, take them out, rinse them, brush them with the toothbrush, you know, swish my mouth out really well, check on the implants, make sure there's no food stuck there or anything like that, and then put the teeth back in and I'm good to go. So it's gotten a lot easier on that aspect. And so when I was at the appointment, I was able to get my teeth out a lot, and that was good. And then he made several adjustments, and I left feeling like my jaw does finally close all the way, and I could tell there was more room to chew on the other side. So I was really happy. He said that I don't need to come back for another 6 to 8 weeks. I was a little confused because he didn't really, because I've heard different things about the time frame for the permanent ones. He made me an appointment for like mid-July. He said I'd come back mid-July and that we could start impressions then. But he also had said maybe 3 to 6 months, so I'm not really sure how long that waits. And I don't think I mentioned before, but the day that I went for this recent appointment, I already had an appointment on the other side of the building with the plastic surgery department. That's the other Dr. Shatkins. Dr. Samuel Shatkins is the plastic surgeon, and his brother is Dr. Todd Shatkins. He's the cosmetic dentist who did my dental surgery. So I actually had an appointment with my plastic surgeon. It was my 1-year checkup after my breast augmentation. I'll just call it a BA from now on, probably, because it's quicker. I had my 1-year checkup with them, and my nurse, her name is Kathy, and when I walked in, both her and the doctor were like, wow, you look different. You're blonde. What else is it? So I told them I just had my teeth done, so they were checking them out, and Kathy, she's seen some other people go through it, so her advice to me was to wait as long as possible before I go start the permanent process, because the better they heal, the longer they heal, the better the permanent result will be. So I will keep that in mind. And then I was showing her some of the issues, and she said, oh yeah, I can really see that. And I said, yeah, they are going to remake them for me. And she said, oh, good, good. I said, well, do they not remake them for everybody? And she said, no, with the mini snap-ins, she said, I believe here at Dr. Shatkins, I don't think you get temporary teeth with your mini implants. I think they only do that for the standard size implants, which I thought was interesting. So I wasn't really sure, you know, that's just what she thought. It wasn't until I was doing a video for you guys showing the price sheet. I've made the video, so I was watching it back to edit it, and noticed in the video when I'm reading the fine print, like with their price book and the price for the dentures that I got, it says in fine print at the bottom, does not include temporary teeth. So if I would have thought that through, or if I would have seen that in the beginning, I would have probably paid more money just to have the option of temporary teeth. But as it went, I really didn't notice that, and I really didn't know. I just was assuming they were temporary. I kind of assumed that most dentures, you get a temporary first. So that was my miscommunication, or my issue. I'm glad that they're remaking them anyway. They said it was because I was so unhappy, like right away, and they could tell. They want me to be happy. And there are issues going on, like structural, anatomical issues. So I'm very happy they're going to remake them. Now I just have to have the patience to wait until everything calms down enough so that, you know, the next one should be the final pair. I don't want to have to do this again. But it's a lot easier to be patient now that I'm not in so much pain. The only thing that makes me sore is after adjustments. Sometimes I get sore for a while. And after these recent adjustments, it's kind of weird, but when I'm chewing on the left now, I feel some give in one of the front ones. It feels like it's lifting up and snagging a little bit, and it's not very comfortable. I'm not really sure what that's about. I think it has something to do with the adjustments. But it is kind of scary to think they can adjust something and really it can throw something else completely off. And I get pretty sore again after adjustments. Like I have some spots in the back of my cheeks that rub on the molars and get pinched, and then they're pretty sore. But usually it only lasts a few days. I still feel like I'm talking a little bit different than normal, but I think it's a lot better than before. I still have absolutely no regrets about this. I'm excited for the rest of the process. I think it should be a lot less painful, and the pain and the unknown is probably the hardest part about going through this, I would say. Like, for me anyway, I get in such dark places when I'm anxious or depressed, or obviously they didn't come out exactly how I wanted them to. And I was so hyped up and excited and like telling everyone before I did it, and then I did it and it was like, fuck. I mean, they're not horrible. I'm going to show you guys up close so you can see, and while I'm talking you can see if I look any different than previous videos. Hopefully this is good lighting. I've been battling with that for a while. I just have to find the best space in my house or outside to do these videos, and like buy some better lighting or something. But I'll show you my teeth now just so you can see how they look after the adjustments that he did. Primarily, like I said, he just made it so that my jaw's shut all the way. I have more room to eat on the right hand side. So we'll show you what they look like. Just straight on my left, my right. And I can show you guys what I'm noticing. Well, first of all, we know this side is lower, so more gums show when I smile. There's another difference though. On this side, this is the side I thought I didn't like because it has a pointier tooth. Like the bottom of this is pointy, right there, and this one's not. That one's straight. So now for my temporaries, or for my permanent pair, I'm going to have to decide, I think, if I want them to stay like that, or if I want both pointy on either side, or if I want them both straight. So I guess you guys can weigh in on that if you have a preference. I feel like this side looks more like my old smile before I had this done, so it's possible. And then the lowers, I'm getting more used to that. They shaved them down, like I think on the 10th day a little bit, and that definitely helped quite a bit. They're getting better, but they're still not 100% what I would like. When I brought up the gum color issue with Dr. Powers, he said, well, don't worry, the permanent ones aren't going to be like that. It's going to be one uniform color all the way through the gums, like a light pink. There won't be any variation where it gets darker right by the teeth, like these spots that get darker. I mean, they seem kind of dark, that's all. I don't know why. Okay, so the permanent ones won't be like that. My question now is, now that I realized that these were never meant to be temporary and they really were permanent, they were made this way anyway as permanent, so that's why I want to make sure when they do my permanent ones that the gum color is something they can fix, because that's kind of like a big part of my smile. I feel like they'd look a lot better if they were just lighter pink gums, even if the teeth were not even or symmetrical or whatever you want to say. If the gum color was a lighter pink, these would look a lot better. So I have to make sure that that's something they can do in the finals and figure out. Really, I don't know. I feel like I need to know why they did it this way so that they don't do it that way again. That's always how I feel. Whenever anything happens, even with plastic surgery, you always have to ask yourself, you know, what went wrong this time so that it doesn't happen next time. Like, I don't know, that's just me. And I only say that just because I'm thinking about having a revision done after I had my breast augmentation done last May of 2018. And it's in the same building where I just had my teeth done. So the two Dr. Shatkins, they work in the same place, opposite sides of the building. That's how I found my dentist. Actually, it was through my plastic surgeon from last year when I got my BA. And they say after a BA, you have to wait about a whole year to really be able to see your results and see, you know, how everything's going to settle. They call it drop in fluff. Some people say that. I believe in that, definitely, because they look a lot different now than they did the first week, let me tell you. So I was thinking about doing some videos about that on this channel, if anyone's interested, just because I got my teeth done and my boobs done, both at the same place. It's the Aesthetic Associate Center of Amherst, New York. Both doctors are Shatkins, and I am thinking about doing a revision or like swapping them out, kind of, which would be a story for another day. I don't have time to tell that story today. Not sure if I'm going to really tell that story here because this channel was supposed to be my dental channel, but yet again, I will see what you guys think about that, and you can let me know if anyone's really interested in what I got and, you know, how that process worked and my little story, I guess, because it's a trip, man. anytime you permanently alter your body, it's a trip. It's like, it's also a blessing. Like, to me, I feel very blessed to be able to have the opportunity to change certain things about myself that have bothered me and plagued me for literally almost my whole life. Like, you know, it's a blessing, but it's also not easy to deal with, and it's a very personal preference. If you know, just imagine how much you have to dislike something about yourself to be willing to permanently change it and risk it just going to hell. Because sometimes that happens. Sometimes you don't even get a good result. Sometimes you get a horrible result, or sometimes you wish you never did it. Those are all risks you have to take. And I'm still there. It still messes with my mind. Because of the, you know, I just don't have the final product yet of my teeth. I don't really know 100% how they're going to look in the end. So it can be a little mind-boggling. And I have already, I've filmed this video a couple times, and then the lighting would just be shitty. So I'm not sure which one I'm going to end up using. Hopefully this one's going to work good because it looks good on my end. Hopefully I'm close enough so you guys can really get a good idea of how these teeth look when I'm talking. And I do have a video that I've already made, the price video, so it will say what I paid, and it will show their other options they have for more permanent levels of the mini snap-in implants, or the just mini dental implants. They have a book about their options and the prices, and even how it breaks it down for into monthly payments if it's financed, etc. So I think it would be interesting and really good information for you guys to see. Aside from that, now that it's been 3 weeks, I can say I don't regret doing this. I don't think I'm going to regret doing this, just for the simple fact that even if the teeth didn't work out, once you have your implants and they're healed, you can go find other people to make the teeth. You can get different teeth in there, you know. But I'm really working hard with my dentist right now. I want to make sure everything's good communication, make sure I'm informed and I know what questions to even ask, because like I said, I just assumed that they always give you a temporary pair. So had I not written that email, and had I not let them know right away that I was unhappy, this could have gone really differently. They might have decided, like, you didn't say you didn't like them. Like, if I waited too long, or waited 3 months from now and then said, well, where's the permanence? They might have said those are permanent. So it's always good to be honest and upfront about your feelings. I feel like it's kind of hard to let them know, you know, when you're not happy. You don't want to offend somebody, but after all is said and done, it's on your body. You're paying for it. They work for you. I mean, you have to be able to be honest with yourself and with them. You have to. If there's something you don't like, you have to be honest. And the only thing I can think back now for, like, the top being lower on one side, I almost think it's from the impression day, because I had the doctor and the nurse on either side of me holding one and one, kind of, and they were talking and showing me the shade card with their other hand, and it was just it just didn't seem like good impressions. It seemed like there was too much movement going on, and maybe I should have said something at the time. So if that happens again during my finals, I'm going to make sure everything is, you know, very secure, very stable, and so, you know, well, I would assume if they make teeth that don't line up down the center, see this? And if they are that uneven, I would assume they're going to fix that shit. You know, that's just me. I'm trying to think of anything that I might be forgetting here. I do have some videos to upload, so there might be a few in a row. Is that it? I think that's how the appointment went. I don't go back until July, the end of July, and I might get some impressions done then. And like I said, we'll see how I'm healing. I do want to take my time with the permanence and make sure that my gums are pretty well settled down before I go forward, because I just don't want to have to deal with another poor fitting or poor looking, or like these weird problems where your jaw doesn't shut. I just don't want to deal with that again, hopefully. I'm sure everything is worth it. You know, it's all worth it in the end once you have your final result. And I'm already much happier with the teeth I have in my mouth right now than before surgery, so it's already a win. You know, to be honest, like, these are better than what I had. They look better every day. They feel better every time they adjust them. It's just a matter of being patient, not letting it get me down. You know, it is not easy to get your teeth pulled and get new teeth, and also share your experience with people in general, and be open to critique and criticisms, and, you know, just people's honest opinions. Like, I like to know what people think, how I look, if I look any different or better than last time or not. But it's still not easy to just not be happy with the result, even if it's temporary. So it's just something to prepare yourself for, and make sure that you have really supportive people in your life when you go through this. This last appointment I went to is the first checkup I went to alone, where I felt like I could go without a support person. Just because in the very beginning you are really emotional, and I probably was more maybe irrational and just not knowing the process completely. Then I don't know what to expect. I didn't know what to ask. I didn't know what was going on, but I knew that I was in pain. I knew that I was emotional. I knew that I didn't look how I wanted to look, and I also knew that that's probably going to be that way for a while. So yeah, not easy to deal with. There's been some dark days in the beginning. I was thinking about doing a video on that, but it's kind of depressing. But it is something that you should prepare yourself for, especially if you're a woman and you go through that time of the month every month, and there can be some low lows there. And when you're going through these things, changing your body, and it's a process, like even with breast implants, when you go in there and have your surgery, you don't look amazing that day. Like, you come out with your new boobs, but they don't look how they're going to look. They almost usually look deformed. They're very flat and compressed and smushed all the way down, sometimes all the way up to your collarbone. It can take months. It usually does take months and months for them to settle down and look normal, feel normal. It's just a lot of mind games. It messes with your head. So if I was doing videos about that, I would definitely go in more depth about that subject and, you know, let you guys know how it went for me, exactly what I got, how I did it, and why, etc., and why I might have a revision after 1 year. It's been a year now. So anyway, if you guys are interested in that, let me know. And if I forgot anything here, let me know. Other than that, I'm going to be working on editing some videos so I can actually post them so you guys get them. There is another, I think it's my last video though. I might delete it and re-upload one that had better lighting, just because that kind of crap drives me nuts. Like, you can't see my teeth hardly at all. It's just not good lighting. So what's the point? I don't know. But that's just me for you. This is why everything takes longer when Alicia does it, you know. Hard to please. Picky. That's what they say. Probably not. I don't know. I don't think I'm that picky, actually. I think I have pretty normal expectations for dental work. I feel like if I was getting regular dentures, I would also expect them to be made well. And being made well, in my opinion, is that they line up and that they're even and they're fucking symmetrical. Right? Yeah. So, no, you can't say that I'm being too picky. They can't tell me I'm being too freaking picky, and I really don't. I don't appreciate that. So, yeah, if they say that one more time, I'm gonna let them know how picky I am about the way they treat me and the way they talk to people. So, all right, I think I'm done, and I'll give you guys one more little look at my teeth. I was gonna try to show you how they look inside my mouth. I'm not gonna take them out this time. I thought about doing that, but that'll be for another video. So they are horseshoe shaped. There is no suction plate on the top one. The bottom you can kind of see. Right there. That's part of the fake denture. And up here, it goes horseshoe shape around. So you can see the roof of my mouth, and it just feels more natural. I like that, and I guess that's an option. I've even seen people with standard dentures being able to get the top palate removed somehow, so that's something to ask about. And I do believe that is it. The only other thing I was going to mention is there's a girl that I found on here. Her name is Spida Liz, and she does updates, and she's got dentures, but she's going to get some remade or made with company Ivoclar. So she was telling people in her last video that she was on her way back from the Ivoclar facility, and she was taping it and showing people how it works. And it's in Amherst, New York, she said, or she was driving back from it in Amherst or Buffalo, New York. And I was like, holy crap, that's where my dentists are. So I didn't know there was an Ivoclar in this area. And for anyone who's watched or been in the denture community for a while, Callan Jacks, she was the first person I ever really found on YouTube that was talking about getting dentures at a young age. And ultimately she ended up having her teeth that she has now made by Ivoclar. So I remember her speaking really highly of them, and I thought it was really cool when Spida Liz was talking about them being in this area, and she said they don't make dentures for individuals, they do it for like companies or dental offices, so you have to ask your dentist if they are familiar with Ivoclar or if they use their products and if they're willing to do that. And so I was thinking about asking my dentist about that. The only thing is, they have their own lab. My dentists have their own lab there, so I'm not sure if they would be like open to having them made by a different company or how that even works. And so yeah, something to think about, and something for you guys to think about if you are, you know, looking at getting some made, and if you're interested in Ivoclar. If you're anywhere around my area, there is one in Buffalo, New York, so yeah, that's pretty cool. I've heard really good things about that company, so I'm really excited to see how Spida Liz, you know, how her teeth come out after this. And yeah, it's exciting. Like, I think she has a lot to do with the selection process. You can even, well, for one thing, I've been trying to find some little Facebook groups to join, like in the denture community for myself, and I haven't been able to find too many, but there's a couple, and the one I think is the dentures before and after denture support group. They have some files there, and they have like pictures of smiles, and then it tells you the personality characteristics of each smile and the teeth shapes and how other people perceive that smile. Like, it might mean you're more type A, or you're more dominant, or there's other ones that are more like a shy smile, or it's very detailed actually, and I thought it was really interesting. So if I ever like, you know, try to alter the shapes of the teeth here and pick new ones out, I would definitely look at those charts and those pictures and just see what they say based on the ones that I like. And yeah, I was just letting you guys know. That's pretty cool because I didn't even know they did that. Anyways, here's my teeth up close one more time. This is just a smile. And up close, like I smile huge. That's not really a natural smile. I'm still not sure how I feel about the bottoms, but anyways, I'm going to let you guys go. You can let me know what you think. I hope I didn't forget too much. I hope I didn't ramble too long. It looks like I did because this is 23 minutes, so I'm going to have to edit some more. Whew, that's it. Let me know how, yeah, that's it. All right, guys, just let me know if you have any questions or video requests. I'm going to be working on that, and hopefully with a good camera and good lighting. So let me know if there's anything else you want to see or anything I forgot to mention. And let me know if I look any different in this video than I did in the past ones. But anyways, thank you for watching. Please subscribe if you're new, and have a great day.